What is neurofibromatosis? Neurofibromatosis is a genetic condition that results in the production of tumors arising from the cells that line nerves in virtually any part of the body. There are approximately 1 in 3,000 individuals living with neurofibromatosis. Now that's pretty frequent. You can very well know someone who has this condition. Neurofibromatosis occurs as the result of a mutation on a very specific gene. It is different depending on the type of neurofibromatosis a person has. In approximately 50% of cases, there is a known parent who can transmit that gene to an offspring and thereby pass on the condition. In another 50% of individuals, the genetic mutation can occur without a known family history. Currently, there is no cure for neurofibromatosis. There are 2 basic types of neurofibromatosis. Depending on the type of neurofibromatosis, type 1 versus type 2, there can be a whole host of findings that go along with this condition. Findings that can affect the skin, that can affect the brain, and even the bones. In type 1 neurofibromatosis, freckling sometimes occurs in the armpits and in the groin areas. One of the classic findings in type 1 neurofibromatosis is the presence of coffee-colored spots on the skin that can occur anywhere on the body. Because of their typical color, they're often referred to as café au lait spots. And there's usually a general darkening of the skin or hyperpigmentation. When looking at the eyes, there can be spots that form on the iris of the eye or the colored part of the eye, and these are called Lisch nodules. Tumors can also grow on the optic nerve itself, called optic gliomas. These may or may not affect vision. Bones can sometimes be underdeveloped and weak, causing orthopedic problems. Scoliosis, or curving of the spine, can occur. There can often be learning disabilities in patients who have the condition. And of course, in type 1 neurofibromatosis, there are tumors themselves called neurofibromas that can occur virtually anywhere on the body. Sometimes large tumors can occur called plexiform neurofibromas, and these can sometimes be disfiguring. The tumors of neurofibromatosis are typically benign, but there is a small rate of malignancy that can occur. In type 2 neurofibromatosis, there may only be mild symptoms until individuals reach their teenage or adult years. What separates type 2 neurofibromatosis from type 1 is the distinct presence of nerve tumors along the nerve responsible for balance and hearing. These are often referred to as either vestibular schwannomas or acoustic neuromas. Brain tumors of other varieties can also occur in type 2 neurofibromatosis. People with neurofibromatosis may not have anything more than a few light-colored birthmarks as children. However, as kids grow, tumors can appear virtually anywhere on the body. Sometimes the tumors remain dormant for a number of years, and sometimes they proliferate quickly and grow. Sometimes these tumors can cause problems related to pain and disfigurement. There is some association between the growth cycle of the tumors and the growth spurts that children can undergo. In most cases, a child's pediatrician may be able to diagnose a few of the signs and symptoms of neurofibromatosis. If this happens, then your child might be referred to a neurologist or a specific neurofibromatosis clinic. There are an established set of criteria that can identify whether a child has neurofibromatosis and actually what type of neurofibromatosis that child might have. In some situations, if there's any doubt as to the diagnosis, a genetic test may be required. Most early management of neurofibromatosis is usually conservative. In other words, we watch and wait. Patients may have lumps or tumors develop on their bodies anytime throughout their lives. Fortunately, most are benign and don't require urgent removal. However, some may start to enlarge and create problems with pain and disfigurement. If this happens, you might be referred to a surgeon specializing in neurofibromatosis. This is usually a plastic surgeon. To find out more information, contact our office.